Hi there, this is the Harvest House Ministry TBRI Implementation Plan, partnered with Lamar University social work students. Harvest House Ministry is a nonprofit organization that was locally founded in 2010 as an initiative to fight child sex trafficking in Southeast Texas and to provide aid, advocacy, and mentoring to victims. Harvest House serves youth who have been sexually exploited or they are at risk to be. The child care advocates have participated in numerous interventions, reaching out to children who have been victimized and providing support to both the child and the family. This ministry has been instrumental in raising awareness about child sex trafficking in Southeast Texas and the surrounding areas through countless speaking engagements, public appearances, and news interviews. They also go out to local businesses and schools to bring about awareness. Another interesting fact is that they have been key in creating an effective collaboration among local services and organizations, such as joining with law enforcement, social services, forensic medicine, and mental health facilities to bring about awareness to this issue and to put a stop to it. Here are a few services that Harvest House Ministry provides. They have commercially sexually exploited youth or CSA advocates and immediate response care teams. They have healthcare and court accompaniment, prevention and intervention with at-risk individuals. They do family education and community education. Now I'm going to introduce to you something called ACEs, which is Adverse Childhood Experiences. Harvest House is trying to be considered, if not already considered, a trauma-informed organization, meaning that it realizes the impact of trauma, including how it can emotionally, behaviorally, and physically affect children, families, staff, and volunteers, as well as the organizations that work with them. Being a trauma-informed organization means that it also recognizes the signs of trauma and consistently incorporates trauma screening and assessment into all aspects of work, including interactions with children, families, staff, and volunteers. Harvest House can use the ACEs assessment tool to help gauge the impact trauma has had on each client. If you want to, go ahead and click on the YouTube link below to watch a 5-minute video explaining a little bit more in detail what ACEs is and the impact that it has. There are several things to consider when looking at the ACEs assessment, but the most important thing to remember is that the ACE score is meant to be as a guideline. If you experience other types of toxic stress over months or years, then those would likely increase your risk of health consequences. There are 10 types of childhood trauma measured in the ACE study. 5 are personal, and the other 5 deal with external factors, like watching something happen as a child. As your ACE score increases, so does the risk of disease, social, and emotional problems. With an ACE score of 4 or more, things start getting serious. The likelihood of chronic pulmonary lung disease increases 390%, hepatitis 240%, depression 460%, and suicide 1,220%. This could even impact someone's life as cutting their lifespan in half. It's important to assess these things for the clients at Harvest House because they can better understand the client's history and take the right steps towards healing and help determine different health risks involved as well for each client. This is the ACE pyramid. The ACE pyramid represents the conceptual framework for the ACE study. The ACE study has uncovered how ACEs are strongly related to development of risk factors for disease and well-being throughout the lifespan from conception to death. As mentioned in the previous slide, the higher the ACE score, the more likely it is for this person to develop the early onset of disease or maybe even lead to early death. Using the ACE assessment paired with the trust-based relational intervention that's about to be mentioned can set kids up with a more bright and long-term, love-filled future.
Trust-based relational intervention was designed by the Karen Purvis Institute of Childhood Development. Trust-based relational intervention is an attachment-based, trauma-informed intervention designed to meet complex needs of vulnerable children. TBRI was designed for children dealing with extreme traumas such as abuse or neglect. Due to these extreme traumas, children have a hard time developing loving and trusting relationships with the adults in their lives. TBRI can be used in any environment, such as homes, agencies, treatment facilities, and schools or even campuses.
So this graphic tells us a little bit about toxic stress in the brain, and it tells us how trust-based relational intervention can combat this. So it starts a little bit off telling us about the brain functions and how these brain functions make us who we become. So we're affected by experiences and interactions with others. Severe and prolonged abuse and neglect has those negative effects on us. It even goes into showing a little bit about how these negative effects can even affect us when we're in the womb. High cortisol levels, which is the stress hormone, can even affect us before we're born. So these toxic stress response affects brain development and can even affect our immune system. It overbuilds the fear section of our brain, which affects emotions and regulation. So TBRI consists of 3 principles. These 3 principles are connecting, empowering, and correcting. So TBRI is responsible for introducing that nurturing that was missing during the abuse and neglect. So physical and emotional safety is the beginning of healing for a child that has experienced prolonged abuse and neglect. Starting with connecting nurtures trusting relationships that weren't there for that child. Empowering meets the physical needs and can address environmental issues. And then correcting corrects those fear-based behaviors and helps make a child feel safe. So high adverse childhood experiences can affect our brain development. So the greater the trauma, the greater effects that we're going to see. Meeting with Harvest House, we found that the first time they began to implement trust-based relational intervention was 2 years ago. So the main issue that we came up with was that they have a minimal amount of staff that has attended the 2-day training through the Karen Purvis Institute of Child Development, but there has been some staff that have been trained there. So they would like to keep implementing TBRI into their organization, but their main needs were around training and full-scale implementation. So continuing with TBRI implementation, we start with where Harvest House currently uses TBRI in their client interactions and treatment, but they did request and show a need for a more organized way to implement it. So we created a logic model that will provide them with an organized approach for that full-scale TBRI implementation for the organization. One of the issues that was mentioned before was that Harvest House has minimal staff that are trained in TBRI. So in order for their staff to gain that fuller comprehension, whenever using it in implementation, they would attend training seminars and have more resources for the staff and the volunteer advocates that are willing to attend the training. So Harvest House has a baseline of implementing TBRI into their treatments, but requires resources to keep staff trained and to provide that staff support. So additional TBRI supplemental training was suggested, and it was also suggested that the program director attended training in order for them to be the implementation coach for the organization that would provide that needed staff support. Harvest House did show a need for additional resources they could give over TBRI to the caregivers of the clients. So we suggested providing resources for caregivers of clients through pamphlets, multimedia presentations, and other support documents that was included into the logic model. So Harvest House currently uses TBRI in working with clients, but they could use more tools and assessments for intake and evaluating adverse childhood experiences, or ACEs. The ACE assessments were provided and recommended to use upon intake into the organization, and these assessments were added into the logic model also. So here we have the logic model that we created for Harvest House, and Harvest House caters to survivors of sex trafficking in the Southeast Texas area. So we came up with 3 goals for our organization. So our first goal really surrounded the staff. It was that employees and volunteer staff will have training opportunities to become proficient in implementing TBRI into the organization. So then our second goal is TBRI implementation will assist Harvest House in the healing and the empowering of their survivors. And our third goal, I guess, goes more for the survivors. It was for the survivors to be able to have more social skills and being able to communicate with the staff and volunteer advocates at Harvest House. So that's really facilitating that relationship between staff and the survivors. Some of our objectives was that all staff would have attended a 2-day training through the Karen Purvis Institute of Child Development by the end of 2020, and also that the volunteer advocates will have either attended that same 2-day training or that they will have attended some kind of training provided through Harvest House. So by January of 2021, we want 100% of the organization staff and volunteer advocates to have a stronger understanding and to have that capability of using the 3 TBRI principles. Staff and volunteer advocates should be able to recognize trauma in their clients and use that TBR training, the tools and assessments that they have learned. So as far as training, we want all staff to complete that 2-day training, and we would highly suggest this for the volunteers. Screening, we have suggested 2 screening tools for them. One of those being the ACE assessment and resilience assessment, and another being the 40 developmental assets assessment for ages 12 to 18, which is adolescents. This would be for the age group that Harvest House typically caters to. And we would want to create a TBRI presentation that Harvest House would be able to share with their staff and volunteers that would give extra training and show them the benefits of using TBRI in the organization. So some outcomes that we have is that we would have all of the staff attend that 2-day training and be a part of the implementation team. We would want the director of the program to be assigned to be the TBRI implementation coach. We'd like to have at least 2 TBRI community support meetings by the end of 2020. We'd like at least 90% of survivors to be administered at least one of those ACE assessments that we suggested, and we'd like TBRI support plans created for at least 95% of the survivors, and we'd want 100% of survivors interviewed to determine the next steps and be able to refer them to community resources. Some short-term outcome measures that we have for Harvest House. Starting with the staff and volunteers, we want them to have a complete understanding of TBRI and have the knowledge and tools needed to implement this when working with their survivors. So we want to increase that self-awareness of TBRI and how they can use it with these survivors who have experienced these traumatic life experiences. Of course, we are going to want to see less burnout and turnover and less compassion fatigue with the staff and volunteer advocates. As far as parents and caregivers go in the short term, we want to improve their understanding of how TBRI can have those positive effects on their survivors, create that environment of physical, psychological, and social safety that's beneficial to the healing process, and we really want to increase their access to these community resources. So short-term outcomes for the survivors would be a decrease in that turnover rate and short-term enrollment that was a concern of Harvest House. We want to increase the feelings of trust with staff and volunteer advocates and increase the feelings of empowerment through the healing process and of course, increase in self-confidence and the use of therapeutic strategies and healthy coping mechanisms. In the long term for staff and volunteers, we'd like to increase the number of volunteers that Harvest House has. We want to contribute to sustaining TBRI knowledge in the organization, and we want to continue the implementation process of TBRI in the working environment as new staff and new volunteer advocates continue to join Harvest House. As far as long-term outcome measures for parents and caregivers, we want to see that improved knowledge and skills that's going to help them with their survivors and help the survivors when coping with trauma. We want to strengthen that parent-guardian relationship with the survivor through the use of TBRI. Looking at survivors' long-term outcome measures that we want to see is going to be building that trusting relationship with Harvest House staff and volunteers, gaining empowerment that would assist the survivors in working through that healing process. And of course, we want to decrease the number of survivors that experience repeated trauma.
Harvest House began implementing TBRI into their organization 2 years ago. Their main need is training current and future staff and advocates. The logic model that we provide at Harvest House gives them an organized plan for current and future training, retaining knowledge and information, and access to much needed resources. Harvest House remains committed to helping survivors of sex trafficking in the Southeast Texas areas and hopes to enhance their services through the implementation of TBRI.